Next is the calculation of doses. So dose is the quantitative amount administered or taken by a patient for the intended medicinal effect. It may be classified as a single dose, a daily dose, a total dose, or divided dose. While a dosage regimen is the schedule of dosing with duration of treatment. So for an example, 3 times a day for 7 days or 5 ml every 12 hours, SOS or as needed. So to compute for the number of doses, you should simply divide the total quantity over the size of the dose. So in using this equation, the total quantity and the size of the dose must be in the same unit of measure. So for example, if the dose of a drug is 200 milligrams, how many doses are contained in 10 grams? So the first thing you need to do is to make sure that the units of the given are the same. So since one is in milligrams and the other is grams, you may choose to convert milligrams to grams or grams to milligrams. So in this example, grams was converted to milligrams. So we have 10 grams times 1000 is equal to 10,000 milligrams. So the number of doses is equal to 10,000 milligrams divided by 200 milligrams. So the answer is 50 doses. In computing the size of the dose, the total quantity is divided to the number of doses. So this is derived from the formula we had previously. So the size of the dose is expressed in whatever denomination is chosen for measuring the given total quantity. For example, how many teaspoonfuls would be prescribed in each dose of an elixir if 180 ml contained 18 doses? Okay, so the size of the dose is equal to 180 ml over 18. So the answer is 10 ml. But the required unit is teaspoonfuls. So how many teaspoonfuls are in 10 ml? The answer is 2 because 1 teaspoon is equal to 5 ml. So another example, how many drops would be prescribed in each dose of a liquid medicine if 15 ml contains 60 doses? So the dispensing dropper calibrates 32 drops per ml. So first, let us determine the number of drops. So how do we do that? We simply multiply the total volume, which is 15 ml, and the number of drops that the dropper can contain. So 15 times 32 drops per ml is equal to 480 drops. Okay, so the size of the dose would be 480 drops divided by 60 doses is equal to 8 drops. So 8 drops is administered for every dose. Okay, so 480 here is the total number of drops or the total quantity of the medicine for the whole regimen. Okay, so what is being asked is the number of drops prescribed in each dose. Okay, that's why we still needed to divide 480 by 60. Okay, for the total quantity, we simply multiply the number of doses by the size of the dose. For example, how many milliliters of liquid medicine would provide a patient with 2 tablespoonfuls twice a day for 8 days? So, the first thing we need to do is to identify or to compute for the number of doses. So, since it should be given for 8 days and twice at that, so we need to multiply 8 by 2. So 8 times 2 is 16. So there will be a total of 16 doses. After that, we should identify the size of the dose. So the size of the dose would be 2 tablespoonfuls. So again, in milliliters, how much is that? So since 1 tablespoon is equal to 15 ml, 2 tablespoonfuls is equal to 30 ml. And next, to find the total quantity, we simply multiply the number of doses by the size of the dose. So 16 times 30 is equal to 480 milliliters. Okay. Easing patients into or out of doses. So let's look at some terms. So first is dose titration. So it is the process of gradually adjusting the dose of a medication, so until optimal results are observed. So why is there a need to do that? So it may help the body adapt to certain medications, and it often reduces side effects, and the adjustment can be increasing or decreasing. Okay, so uh, so the keyword here is gradual. Okay, so this term is similar with tapering. So it is a process of easing a patient into or out of a certain medication dose by not starting on full dose of a drug right away or not discontinuing a medication dose abruptly. So again, gradual. Okay. Now, the term desensitization is the process of starting a patient with very small doses and then rapidly increasing the dose for the patient to develop tolerance to the immune response caused by the drug. So when we say desensitize, it means that uh, we take out the effect from to the body, like the body is desensitized, or so that the medicine will no longer take effect. So how do we do that? We start with small doses and then we rapidly increase the dose. Okay, so the keyword is rapid increase. Okay, so take note of these terms. Okay, so here's a sample problem. So a patient brings in a prescription for a prednisone taper as follows. So prednisone 30 milligrams PO tonight, 20 milligrams PO BID tomorrow and day 3, 10 milligrams PO BID days 4 and 5, 10 milligrams PO QD days 6 and 7, 5 milligrams PO QD days 8 and 9, then off. So before we proceed, what does PO mean? Means per orem or by mouth. So this is an oral tablet. Okay, so I mean it should be taken orally. And when we say BID, it means twice a day. QD, once a day. Okay, so the available prednisone tablets in the pharmacy are in 1, 5, 10, 20, and 50 milligrams. So as a pharmacist, what strength and quantity should you dispense? What instructions will you give the patient? So this question requires us identifying uh, or giving the patient the proper advice on what strength to buy and how to take the medicine. Okay, so here is what we should do. So here is the solution. So the patient will find it easier that he only has to handle one type of tablet for all the doses. So given the instruction, what dose or what kind of tablet strength should be used? The answer is 5 milligrams. Okay. Now, a total of 36 tablets of the 5 milligram strength will be dispensed. So you should give the following instructions to the patient. So for day 1, 6 tablets tonight. Day 2, 4 tablets twice daily. Day 3, 4 tablets twice daily. Day 4, 2 tablets twice daily. Day 5, 2 tablets twice daily. Day 6, 2 tablets once daily. Day 7, 2 tablets once daily. Day 8 and day 9, 1 tablet daily. And for day 10, off. Okay, so as you can see in the prescription, the regimen started with a high amount or a high dose of prednisone. So from 30 milligrams, it slowly tapered to 20, 10, and then 5. Okay. Uh, so this is an example of that situation. Okay. So I hope you understood how we got this instruction. So if you base it here on the request, you may trace why this is the most logical answer to this problem. Okay? Drug dosage adjustments. So There will be times that the drug dose should be adjusted because of certain factors such as age or disease. So the most common, one of the most common examples for this situation would be for pediatric patients. So here, I have given the notes for each term. So when a child is from birth to 1 month, it is called a neonate. 1 month to 1 year, infant. 1 to 3 years, toddlers. 3 to 5 years, preschoolers. 6 to 12 years, school age. And for 13 to 17 years, adolescents. So doses in children need to be adjusted because of underdeveloped body systems. For example, kidney function, liver enzymes, and others. And generally, they have smaller total body mass. So similarly, dosing in geriatric patients, meaning those who are older, much older, or mga senior citizens, can be lower than typical adult dosing due to the degeneration of drug handling systems. Okay, so there are rules or equations that can be used in adjusting the patient dose for pediatric patients. So there are three based on age: Young's rule, Cowling's rule, and Fright's rule. So you need to memorize all of these. Okay, so this is quite easy to memorize. You just need to take note of the concept, right? So for the Young's rule, we have child dose is equal to the age of the child over the age plus 12. So 12 here is the usual or the average age of a child. So times the adult dose. For Cowling's rule, it is the age in years plus 1 over 24 times the adult dose. And for Fright's rule, this is used for infants and children up to 2 years. So we will use, instead of age in years, we use age in months. So age in months over 150 times the adult dose. So based on body weight, here is how you compute for the dose. So patient's dose in milligrams is equal to the patient's weight in kilogram times the drug dose in milligrams per kilogram. Okay, so example, the usual initial dose of chlorambucil is 150 micrograms per kilogram of body weight. So how many milligrams should be administered to the person weighing 154 pounds? Okay, so there are very unlike units here. So first we have the microgram over kilogram, and then the required unit is milligrams, and the given unit is pounds. So the first thing we need to do is to convert all of those to workable units. So solving by the equation, we use 150 micrograms, convert it to milligrams. So we will have 0.15 milligrams per kilogram. Next is to convert the pounds into kilograms. So here we have a conversion factor. 1 kilogram is equal to 2.2 pounds. But here the author put it directly. Okay, so do not be confused, because since the unit here should be milligrams per kilogram, right? So here, milligrams per kilogram. So since 1 kilogram is equal to 2.2 pounds, it has been placed there instead of 1 kilogram for a more direct approach in solving. So the equation would be 154 pounds times 0.15 milligrams per 2.2 pounds. So we cancel pounds, we cancel the like units, and then we arrive with 10.5 milligrams of chlorambucil. Okay, so another approach to this problem would be by ratio and proportion. So 150 micrograms is equal to 0.50 milligrams. 1 kilogram is equal to 2.2 pounds. So if there is 2.2 pounds needed for 0.15 milligrams, how many milligrams is needed for 154 pounds? Okay, so again, look at the relationship. Okay, so magkakatapat sila so that they can be cancelled. Okay, so the answer again is 10.5 milligrams. And lastly, it can be solved by dimensional analysis. So there is unit setup, okay? So 1 milligram over 1000 micrograms times 150 micrograms per kilogram times 1 kilogram over 2.2 pounds times 154 pounds is equal to 10.5 milligrams. So if you look at it closely, we will be able to cancel out the like units. So mcg, mcg, kilogram, kilogram, pounds, pounds. So the final answer or the final unit is in milligrams. Okay. So again, let me reiterate that there is no one solution or one method. There is no one method to solving problems. Okay, so as long as you apply the proper techniques, you will be able to arrive at the right answer. Okay, so another equation that can be used to compute for the dose based on body weight is the Clark's rule. So the child dose is equal to the weight in pounds over 150 pounds times the adult dose. So 150 is the average or the the average weight in pounds of a child. Okay. So another method is based on BSA or body surface area. So this method is a better indicator of metabolic mass than body weight alone. So BSA unit is in meters squared. So doses can be expressed per meter squared. So often used in calculation of doses of anti-cancer agents in chemotherapy and pediatric patients except for premature and neonates. So common methods used to calculate PSA include the Bois method, Musteller method, and using a monogram. So memorize this again, okay? So what is a BSA monogram? So it is a standard label which allows a simple graphical determination of BSA using two columns of weight and height and a corresponding column for BSA. So how do we use this? For example, a child is, let's say, 160 centimeters tall and weighs 105 kilograms. So you will draw a line, or you will use a ruler and place it on the 160 point and the 125 point, and then wherever it lands on the body surface area scale or column, that is the BSA. So using the adult dose in a child's BSA, here is an equation. So child's BSA in meters squared divided by 1.73 meters squared. So 1.73 meters squared is the average adult BSA. So that is a constant. Okay. Selected clinical calculations. Okay, so here are problems involving activity. So first, units of activity. So example, how many units of U100 insulin should be used to obtain 40 units of insulin? So we must know that U100 insulin contains 100 units per ml. So since there is 100 units per 1 ml, we will now find the amount of milliliters present in that contains 40 units. So we should write the equation as follows. So we will arrive with 0.4 ml as the answer. Next, activity based on weight. So example, if neomycin sulfate has a potency of 600 micrograms of neomycin per milligram, how many milligrams of neomycin sulfate would be equivalent in potency to 1 milligram of neomycin? Okay, so the given states that neomycin sulfate has a potency of 600 micrograms per milligram. So it is written here, 600 micrograms per 1 milligram. Now, what is asked is the potency equivalent to this. If there is 1000 milligrams of neomycin. So we write this equation and we will arrive with 1.67 milligrams. Okay, lastly, we have dose or antigen content of a biologic based on potency. So a biologic contains 50 LF units of diphtheria toxide in each 2.5 ml of product. If a pediatric patient is to receive 10 LF units, how many milliliters of the product should be administered? So if there is 50 per 2.5 ml, how many ml is needed to administer only 10? So the answer is 0.5 ml. So as you can see, you can compare the ways the given have been placed in the equation so that you can be familiar with how they are solved. Okay, so they are similar. The approach is very similar. You just need to take note of the proper units or of the proper placement of the given. Okay, so next is heparin. So here are example calculations of heparin dosing. So an intravenous infusion contains 20,000 units of heparin sodium in 1,000 ml of D5W. D5W is 5% dextrose in water. So the rate of infusion was set at 1,600 units per hour for a 160-pound patient. So calculate A, the concentration of heparin sodium in the infusion in units per ml, B, the length of time the infusion would run in hours, and C, the dose of heparin sodium administered to the patient on a unit per kilogram per minute basis. Okay, so I know that this is a lot to handle, given that there are 3 questions in one question. Okay, so the approach is, first, do not be scared or do not panic. Okay, so first you should identify the given. So we have 20,000 units of heparin sodium, and that is dissolved in 1,000 ml of D5W. We also have the rate of infusion, which is 1,600 units per hour for a 160-pound patient. Okay, so the first question asks the concentration of heparin sodium in the infusion in units per ml. So what given should we use? Of course, we should use the total number of units, which is 20,000, and the volume of the infusion, which is 1,000 ml. So we simply divide 20,000 and 1,000 to arrive with the units of units per ml. So 20,000 divided by 1,000 is 20 units per ml. Okay, next, the length of time the infusion would run in hours. Okay, so given yung rate of infusion, which is 1,600 units per hour, right? So since 1,000 units per hour is being administered, how many hours would it take to administer 20,000 units? So we simply divide 20,000 by 1,600. Okay, so the answer is 12.5 hours. Okay, so this is simple math. So I believe you can do it. Okay, for the last question, what is asked is the dose of heparin sodium administered to the patient on a unit per kilogram per minute basis. Okay, so here we will use the remaining given. So, but first we should convert pounds to kilograms first, since that is the required unit. So 160 pounds is equal to 72.7 kilograms. And again, the conversion factor is 1 kilogram is equal to 2.2 pounds. Okay. So next is 12.5 hours converted to minutes. So since what the required unit is unit per kilogram per minute, we will also convert this. So 12.5, how many hours in a minute? Or how many minutes in an hour? There is 60 minutes. So we multiply 12.5 times 60. So we will have 750 minutes. And next, we will divide the total number of units per the number of minutes. So we will have 26.67 units per minute. And then since we were asked the number of units per kilogram. We will also divide this by the number of kilograms. Okay, so the answer is 0.37 units per kilogram per minute. Okay, so here are problems for ideal body weight. So take note of the following equations. Okay, so and here is an example. So you try solving it on your own. Okay, so next is creatinine clearance. So creatinine is a breakdown product of muscle metabolism that is constantly produced and eliminated from the body through renal filtration. So if the creatinine clearance is decreased, it may indicate a reduced kidney performance. So we should take note of the normal serum creatinine, which is 0.7 to 1.5 milligrams per deciliter, and the unit of creatinine clearance, which is milliliters per minute. Okay, so the creatinine clearance can be solved using two equations. Okay, but for each equation, the sex of the patient is considered. Okay, so again, memorize these equations. Okay, so for males, for the Joliffe equation, we have creatinine clearance is equal to 98 minus 0.8 times the patient's age in years minus 20 over the serum creatinine in milligrams per deciliters. For the females, you simply multiply what you got from here with 0.9. And for the Cockcroft-Gault equation, the creatinine clearance is equal to 140 minus the patient's age in years times the body weight in kilograms over 72 times serum creatinine in milligrams per deciliter. And you multiply 0.85 of your answer to derive the creatinine clearance for the female. So you will use whatever equation, you can use whatever equation, but it depends on what is given, okay, or on what is required. So there are two other equations, Sanaka and Schwartz, wherein Sanaka is used for patients over 60 of age, for geriatric patients, and Schwartz is used for pediatric and adolescent patients. Okay, so memorize.